Right. So if a patient were to see you, and I suppose they would be on the ward,
Mhm.
what are some of the interactions, or what would they expect working with a PA?
So I don't think there's really anything that different for them to expect, from seeing a PA to seeing one of the hospitalists, because the way our program works is that, we have several hospitalists who see the patients, and there's me as well. So I'm seeing the patients that my supervising physician would have been seeing, but he's also doing a lot of administrative work because he's kind of the most responsible physician for the whole service. If a patient is seeing me, they would expect daily medical visits from me. Any diagnosis, treatment, I would be doing. Any procedures, so we do lumbar punctures, we do paracentesis, thoracentesis, bone marrow biopsies. So I would be doing them if they were my patient. We would be talking about their goals of care. We would talk about any discharge planning. So all of the things that they would expect to see from a doctor on the team, they could also receive that from me.
Are you involved in family meetings?
Yes. So if it is one of my patients, so I see about 8 patients a day. If it involves one of my patients, then usually I'm running the meeting, or the social worker is, and I'm acting as a close right hand, providing all the medical updates.
Can you sort of walk us through how you would start a typical day at the hospital?
Sure. So there's no real structure or schedule to it. Usually we start at 9 o'clock. I come in and meet with the rest of the hospitalists and my supervising physician, and he basically divides up the patients amongst us. So typically the hospitalist will see 12 patients and I'll see 8. And then after that, we each go in for bullet rounds where we discuss our plans for our patients with the rest of the allied health team and the team leader. And then throughout the day, basically I'm seeing patients. I see them in order of acuity, so whoever is least stable gets seen first. And then I try to save any family meetings or procedures for the afternoon. And lately I've also started a research project in hospital. So I'm co-principal investigator for a research project within our ward. So I usually work with the research assistants and try to guide them along the process in the afternoons as well.
So is your schedule typically 9 to 5, or do you ever do evenings, weekends call?
It's 9 to 5. I think that there could be the option to do call, but typically because we do have residents doing it, I've been able to avoid that, which is nice.
So what differences has the department noticed since adding a PA to the oncology department?
So I think the biggest difference would be that my supervising physician is able to dedicate more time to administrative work. Typically, he would have to split his time between seeing patients, overseeing the whole service, and then having to kind of go back and do the administrative work. So now he's been able to assign his patient load to me while he attends to everything else. So I think that's really helped our group function smoothly. And I think that our group has been able to evolve because of that.
What do you find challenging about working in oncology?
A higher likelihood of burnout. I've definitely found myself feeling emotionally burnt out at times. But I think that that's where, you have to kind of do a lot of self-care and also really remember the moments where you've made a difference in someone's life. I think it gets difficult if you feel attached to a patient, or you meet someone who's young, who, just started their life and are diagnosed with, very serious illness. So I think those can be difficult. But I also feel that when you feel like you've made a difference in their life and that you've maybe made this horrible situation a little bit better for them, that it's also quite rewarding.
Are you in a situation where you're breaking bad news, or is it
Yes.
they're sort of in sort of the later stages with patients that you're working with?
It's really a variety.
Okay.
So I do feel that, and I think that the bad news doesn't always just start at the later stages. Sometimes,
Necessarily.
yeah, sometimes, if there's just progression of disease or if someone has a new diagnosis, like those are all really heartbreaking scenarios for a person. Or just even, if they lose function of their legs, they could live for another year, but if it means that they're not walking, that's also equally devastating for someone. So I've definitely had to break bad news, and I think that was one of the overwhelming things during the first year of practice. I kind of thought to myself, like, I'm 23 years old, and I've been breaking a lot of bad news, and it's very difficult. But I think one of the palliative care physicians I met actually said that her job makes her feel like she appreciates life even more. So when you look at it from that perspective, sometimes I think that it's a job that really keeps you grounded.
Absolutely. And so what kind of PA or person would do well in a field like oncology?
I think someone who's optimistic, who is also very introspective, and I guess someone who's very very introspective and knows how to reflect. I think those are the types of people who would do well with oncology. But I also think someone who has a good sense of humor. Mm-hmm. It's interesting because even patients, will have a really good sense of humor about things. So, sometimes you think that you're coming in and, you're feeling kind of glum, but the patient will crack a joke that you may even sometimes think is inappropriate for their situation. But
right.
That's how you get through things. So I think if you can have a good balance of being very, resilient and have a sense of humor, but also, be introspective and be a sensitive person, I think that, that's a good fit for oncology.